Hey, welcome back for another episode of Porn Brain Rewire with me, Dr. Trish Leigh. Today we are going to discuss if porn causes ADHD. Yes, I know that's a big conversation that's definitely loaded, but I wanted to broach the subject because it's National ADHD Awareness Month. So I talk to so many men who tell me that they were just diagnosed with adult ADHD. And I gotta tell you, it chaps my arse a little bit when I hear it so often. And I'm going to tell you why. But in this podcast, what we're going to do is we are first going to discuss what ADHD is in terms of brain performance, in terms of frontal lobe functioning, in terms of the reward system. This is a good conversation for everybody. Attention. We'll just talk about attention first and then the lack of attention. So stay with me for that piece. Then we're going to go to what porn does to your brain in relation to attention and focus and ADHD. Then third, what we're going to do is talk about how can you know for sure if you have what I call quote unquote organic ADHD, or if your brain has been impacted by porn use in a similar but different way. And then stay with me until the end of this podcast because, of course, I'm going to have your brain hack strategy for the day on how you can improve your attention and focus. Okay, so let's dig in, get your journal out, get your pen out so that you can process these concepts, especially if you struggle with attention or if you have been diagnosed with ADHD. Okay, number one, let's talk about what is ADHD in terms of brain performance or brain functioning. So we are going to back up to attention. So we'll start with the conversation on how does attention fall out in the brain? Well, basically, very simplified, in terms of the way I think about brain performance, which is using EEG, electroencephalogram, there have been all the areas of our brain have been identified for the skill or ability that they are in control of. So we know that this area, if you're watching me on YouTube, this area up in the left frontal lobe is the area that's primarily responsible for attention, working memory. Over on the right-hand side, we also have impulse control and judgment. So the whole frontal lobe, we're going to keep it simple. I was going to go on, but I vowed to keep it simple, so we're not here for 52 minutes again. But the frontal lobe is for attention, focus, working memory on the left, impulse control and judgment primarily on the right. The entire frontal lobe is for socialization. And we know that the frontal lobe is linked through pathways to the reward center in the midbrain. So attention is primarily up front in your brain. And when you have the ability to focus and you're in calm focus, you have the ability to attend, you're not impacted by distractors, your brain is running at the perfect speed to be able to focus on what you are doing and then be able to move through small steps to a larger end goal, gleaning rewards at tiny small pieces or at small amounts along the way, but then culminating in the completion of a bigger project. This is called executive function. At the completion of this bigger project, your brain gets a larger amount of dopamine. So that's what optimal brain performance feels like when your frontal lobe is running well. Now, what I mean by running well is that it's using electrical energy at the perfect frequency. And frequency is hertz. It's literally cycles per second of how fast that electrical energy is moving in your brain. So typically between around 12 and 15 hertz is optimal frequency for calm focus. Calmer is going to be down closer to 10. More focused is going to be up to 15 hertz. 15 hertz is 15 cycles per second. It's your brain's humming along at a perfect speed, if you can conceptualize it. And I've got my fingers twirling at a really comfortable rate on YouTube if you're watching me there. So what happens when you have difficulty with attention? One of two things or both simultaneously occur. So one of these two things might happen, or they might happen comorbidly at the same time. The first thing is that your brain might be running too slow. So, if you have organic ADHD, you were born with a brain that at rest or when you're trying to focus runs a little bit slower, closer to 7 hertz. So, it's functioning down here more slowly, which makes it difficult to attend because we want it up at 12 to 15 hertz. That's why doctors will prescribe stimulant medication because the goal is to get this slower 5 to 7 hertz brain to go 12 to 15 hertz in the day. Unfortunately, there's many very challenging ramifications to taking a stimulant medication in the short run and definitely in the long run. So the goal is, though, to speed up the brain from 5 to 7 hertz to 12 to 15 hertz so it's humming along. So the organic ADHD is a brain that is using too much slow processing speed. And the way that I talk about this slow speed is kind of like your brain has the brakes on. And the reason I say that is because 12 to 15 hertz is a speed called beta, and it's kind of perfect processing speed. This slower speed, 5 to 7 hertz, is called theta. Theta's like having the brakes on in your brain. Theta is supposed to engage to make you feel groggy and to help you fall asleep in the evening. It's not supposed to be engaged while you're at work or while you're at school. That's what will drag your brain and make you feel tired or fatigued or make it feel very difficult to attend. It also creates impulsivity or the need for stimulation because the slower running brain wants to find something to stimulate it to help it speed up. So theta kind of gets a bad rap, but it gets the bad rap because it's creating all of these challenges within the day when we really want it to engage in the evening to engage the sleep cycle. So this slow speed's called theta. It's like putting the brakes on, but you don't want the brakes on in your brain during the day. You want your foot off the brake and your brain gassing at the perfect speed, 12 to 15 hertz for calm focus. Now, I said one of two things or both is happening. The second thing is that your brain might be running entirely too fast. It could be running up to 30 hertz, double that 12 to 15 hertz cycle. And I've got my fingers whirring away on YouTube. So if your brain is going this fast, it's like one of those bullet trains. If you're on a bullet train, not that I've been, but if you're on a bullet train, you can't see the trees within the forest because your brain is going so fast. So it's difficult to focus and it's difficult to get things done well because your brain is going so fast, you can't slow it down enough to focus well enough to do what you need to do to succeed in terms of cognition. So this extra fast speed is called high beta. High beta is the speed of anxiety, stress, rushing, overdrive, get things done, survival mode. So high beta is that extra fast speed. Theta is the slow speed. And I'm constantly talking about these speeds here in terms of the pendulum effect. So I told you that your brain can also be in both of those modes simultaneously. We know from the science that high beta and theta coexist comorbidly at the same time more often than not. So if your brain is running slow because you were born with ADHD, what it inherently does is it puts the pedal to the metal to compensate for the slower speed, for the braking. So if you were born with ADHD, you will get this speeding up of the brain most of the time. Some people don't, but most people do. And I'm going to tell you how you can know in just a few minutes. But that's the feeling of braking and gassing. That's the feeling of wanting to be calmed down, but also wanting to be stimulated. That's the feeling of wired and tired. And that is the pendulum brain. And it creates a lot of strain in the system. So I've started to call it strained brain. And if your brain is so strained, it needs something to take the edge off. And that's how it feels to many people. So going back to ADHD for a few more minutes is that we know that ADHD is decreased functioning in the frontal lobe. It's damage to the frontal lobe or dysfunction dysfunction. Damage is the wrong word. That's a porn term. I'm going to talk about that in a minute. And you might see where I'm going with this. But it is less than optimal functioning. And I know that, there's neurodiversity. And I'm one of the biggest celebrators of neurodiversity. Being the mama bear of 5.5 kids that are all completely different, neurodiversity is my jam. But what I don't enjoy about quote unquote neurodiversity is when it creates problems for people and challenges and they don't know how to overcome it and they struggle through life because their brain was born going too slow. And so I've been helping people with ADHD for over 30 years. And this is something that's important to me because I want people to know that's the beauty of neuroplasticity. Just because your brain is running too slow, we can make your brain run a little bit faster so that it's at that optimal processing speed so you can think well, you can feel well, and you can perform better. And the struggle goes down. So that's what I want people to know about ADHD, but I am digressing here. So what I'm talking about is a brain pattern that's causing you issues. And we know that the marker for ADHD is something that's called a TBR, theta to beta ratio. So many times theta is too high. And I told you it might comorbidly have high beta, but for many people, beta, that 12 to 15 hertz, is also running low. And that's a person with slower processing speed, not the brakes on, just the gas is going a little bit slower. So when I measure people's brain performance patterns, I'm looking at the TBR ratio. And yep, we're putting the cart ahead of the horse, so we're not going to go there. But ADHD is a theta to beta ratio that's too high. Too much theta, possibly not enough beta, and most times too much high beta is coexisting. And it gives a person the feeling of not being able to focus, not being able to attend, being highly distracted, hyperactivity. Hyperactivity physically is self-stimulation using the body to offset the slow speed. It gives people anxiety, overthinking. Overthinking is self-stimulation of the slower speed using your mind. So this slow processing speed can create a lot of challenges for people. So at the same time, we also know that dopamine levels are low in people who have ADHD. And that cascading of the neurotransmitters has to do with how the brain is using electrical energy. So the electrical energy in your brain is like your software. It's the software that's running the show. And then the cascade of neurotransmitters falls out from the optimal brain performance pattern all the way out to highly dysregulated brain patterns, dysfunctional brain patterns. So essentially, the more dysfunction, the more the cascade of neurotransmitters and hormones and physiological processes are going to change. So if your brain is in the middle, in that sweet spot, in the green zone, as I call it, because it's a green QEEG brain map, then the processes in your body are going to fall out in a healthy way. So the greater the magnitude of brain dysfunction, the greater the magnitude of dysfunction of neurotransmitters, hormones, chemicals, physiological processes in the body. Okay, hopefully you're with me on that. But I'm going to tell you in 2 more sections what you can do about that if you're interested. But right now, let's segue to number 2. How does porn impact your brain, especially in relation to ADHD? Okay, so now if you've been watching my videos, there's over 800 videos on YouTube, or if you've been following my podcast here, you know that the same brain pattern, the pendulum brain or the strained brain, is at the core of a problematic porn use habit. So if you've been compulsively using pornography for 5 years, 10 years, 15 years, 1 year, if you've gone back to the screen to get more dopamine, and you might see where I'm going with this, to get more dopamine to feel good and to offset those feelings of needing stimulation or needing to be calmed down, it's in fact very much related. So the question here on this video is, does porn cause ADHD? And I'm going to answer it at the end. But the question's more difficult than that. It's more symbiotic than just cause and effect. And that's what we're going to break down in just a second. So if you saw the movie Venom, such a good movie. I know some people don't think it is, but Venom is kind of the, he's a symbiote. I was going to say alter ego, but he's not really an alter ego. He's the symbiote to Spider-Man, and then he impacts people in a negative way because the symbiosis means that they feed off of each other. And that's what's happening in the Venom movie. But the symbiosis is it's a feeding off of each other. So in terms of ADHD and porn use, they are definitely feeding off each other. But if you do not have the organic ADHD pattern and you are consuming pornography, we know it's decreasing functioning in the frontal lobe and it's desensitizing the reward center. What does that sound like? It sounds like the brain pattern that causes ADHD. So, in fact, it's causing the brain pattern that causes the symptomology of ADHD. But they're different because ADHD is a neurodevelopmental disorder, which means your brain was born with that slow processing speed of too much theta. So for some people who've had a porn habit for a long time, your brain was not born with too much theta. What happened was you found porn in adolescence, and I'm going to tell you how it happens, and I think it's mind-blowing. I'm going to tell you how this happens in 1 second, but you found porn in adolescence, and it made it so that your brain used too much theta across the rest of development. So I'm going to say that again, is that you found porn in adolescence when your brain was still developing, which most people do. What happens is your brain continues to use too much theta when theta should have been decreasing in terms of its use. And this is the way that it happens. And I think this is kind of cool to know anyways, is that when a baby is born, the baby sleeps all the time, right? So that means the baby's brain is using primarily extra slow speed, delta. The baby sleeps all the time. Then into childhood, the baby sleeps less and is awake more and is highly imaginative and creative. That means the brain starts using more theta, less delta. Then when you're a young child and into adolescence, what happens is you sleep even less and your brain starts using more beta and using less theta. But if porn gets into the mix at that time in development, the decrease in theta doesn't happen. It actually increases because of porn use. And the beta use doesn't increase. It stabilizes and stays there. And every time you go back to porn, you're increasing the use of theta, decreasing functioning in the frontal lobe. And you're also desensitizing the reward center through high levels of dopamine. And so, in fact, if you consume pornography for any amount of time, you can, in fact, cause the creation or the inception of the ADHD brain pattern in your brain. Okay, so now going back to the idea of symbiosis is that people who have organic ADHD naturally want more stimulation. And so in a research article that's by Kenneth Blum and Associates, he talks about it as reward deficiency syndrome, and that ADHD is one diagnosis that falls into reward deficiency syndrome. And what that means is it's a brain with less dopamine that seeks out more dopamine or seeks out more stimulation to feel good. So that's the symbiotic nature, is that if you were born with ADHD, you have a stronger propensity to want to go to porn to feel good because inherently your brain needs it more than an optimally developed brain that uses faster processing speed. You want the stimulation more. And then knowing that that brain pattern is linked to the anxiety brain pattern, you also want the calming more. So if you actually are diagnosed with organic ADHD, you need porn more than a person who wasn't born with organic ADHD. But then in watching porn, your brain is accelerating the ADHD pattern. So you need it more and more and more and more because that's the nature of dopamine. And even if you weren't born with the organic ADHD pattern, you are creating it and reinforcing it over time, over and over and over. So porn can cause the feelings of ADHD because it causes the ADHD brain pattern for those who weren't born with it. Those who were born with ADHD have a higher likelihood of wanting to go to porn to feel calmed and stimulated, but in doing so, it's worsening the ADHD brain pattern. That's the takeaway from all of this. I'm going to say it one more time. If you were born with ADHD, there's a higher likelihood that you want to go into the screen to consume pornography to feel stimulated and calmed. But in doing so, you're worsening your ADHD. If you weren't born with ADHD, you likely found it in adolescence and started to brew the ADHD brain pattern in there that wasn't there inherently when you were born. But the more you've gone back to porn, you are making it so that your brain uses the ADHD brain pattern. And in fact, then you're giving yourself symptoms of ADHD, like lack of focus, difficulty with executive function, easily distracted, impulse control and judgment issues, and social anxiety. So let's segue to number 3. How do you know if you have organic ADHD or if you might have porn-induced ADHD? So this is how you know. Before 3rd grade, before you found porn, one or the other, did you have learning challenges? People with organic ADHD, they struggled with learning all along. And they might have had hyperactive behavior when they were young. They had some self-stimulation behaviors. And then when porn came into the mix, porn became the self-stimulation behavior. So an easy way to think about it is, before 3rd grade or before you found porn, did you have learning challenges? Was learning difficult for you? Did you have some of these symptoms? And if the answer is yes, it's likely you have the organic ADHD pattern, which puts you more at risk for enjoying porn because of the reward deficiency syndrome that pattern gives your brain. Now, if you were a strong learner until you found porn, and then in middle school and in high school, things started to crap the bed a little bit, and the struggle became real in college, then it's more likely that it's porn-induced ADHD because your brain was using 12 to 15 hertz when you were young. And then when porn came into the mix, it started to increase the slower speed, 5 to 7 hertz. And if you kept going back, you're slowing your brain down even more. Now, another thing happens in porn too is that it will lower power in the brain. And if you consume a lot of pornography for over the course of a long time, frequent, consistent, and especially intense, and especially if you are involved in edging in any way, which means you're going back to porn or masturbation or fantasy without orgasm to keep your brain lingered in this dopamine state. If you are involved in any of that and you're really struggling with focus, attention, and distraction and erectile dysfunction, likely what's happened is you've shifted your brain into drain brain, which is like an artificially induced, long-term dopamine-induced state. And it can create porn-induced ADHD because your brain is stuck in neutral. There's no more gassing, there's no more braking, you're stuck in neutral. That's an escalation type of brain pattern that comes out of long-term porn use, whether you had organic ADHD or not. Okay, so another way that you can know if you have true organic ADHD and if it's more porn-induced ADHD is to have a QEEG brain map. This is what I do all day, every day. I can use technology in your home, which makes it so easy. I work with people all over the world. I can see exactly what brain patterns your brain is using. I can see if it's more organic. I can see if it's more porn-induced ADHD. I can see if there's the anxiety piece. I can see exactly how much theta is being used in the frontal lobe or anywhere else. It's very measurable. It's called quantitative EEG, electroencephalogram. and it measures how your brain is performing in all of the areas that I talked about. And I can even see the magnitude of ADHD. I can see the magnitude of porn-induced ADHD. I can see the magnitude of erectile dysfunction, meaning I can see if you're 1 level off from optimal, if you're 6 levels off from optimal in every single brain area. And then obviously, the more dysfunction, the more it changes all of that cascade of neurotransmitters, hormones, and physiological processes. That's why the bigger the dysfunction, the bigger the problems you'll have. So that's how you can know faux show. That's how you can know for sure, is doing a measurable brain map. And if you're interested, go over to drtrishleigh.com. Under Work with Dr. Trish Leigh, there's a tab that says QEEG Brain Map. Check it out. You'll see the brain pattern for ADHD. You'll see the brain pattern for internet addictions. They are different, but they are symbiotic, and they're like venom in nature. Okay, so what's your brain hack strategy for the day? So this is an easy one. It's probably going to frustrate you. If you are struggling with focus, distraction, attention, it is imperative that you stop watching pornography. Whether you have the organic ADHD brain pattern or the porn-induced one, if you are struggling with thinking, cognition, if you have brain fog's different than ADHD. It is more of a porn-induced ADHD because it's born out of a different brain pattern. If you struggle with any of this, you can make it better by not watching porn. So that is the takeaway, because I want you to know, no matter if you have organic or not, porn is making it worse. And I get emails from people all the time saying, I can't believe how much better I feel. I thought you were nutty when I first heard you, but then I've been able to stay out of the screen for 35 days, 172 days, and my life is completely different. So if you want your brain to heal, you have to stay out of the screen. Then I've already told you, our brains can use neuroplasticity. Neuroplasticity is our brain's changeability. It isn't inherent that it's going to heal. It has to be pushed in a direction. And our brains are plastic, so they will follow the direction they are pushed in. So right now, if you're going back into the screen, you're pushing your brain in the direction of ADHD. So that's why when you stop watching porn, you stop pushing your brain in the direction of ADHD. So you've unwired that piece, but it doesn't mean you've rewired your brain back to optimal processing of calm focus. That's what we need to get you to do. So if you're able to stay out of pornography and stay out of the screen, if you're not, let me start there. If you're not able to, you need to check out my 90-day complete essential guide. It's essential that you stop watching porn. So if you're not able to stop watching porn, go to my website under Porn Brain Rewire, check out the digital programs. The 90-day program is what you need. It has everything to stay out of the screen. But if you've already been able to stay out of the screen and your brain hasn't rewired itself, I offer a really short course called Brain Training 101, where I teach you how to use technology. And I've talked about the brain training headband on this podcast before, but I know that nobody understands what I'm talking about. So if you get into Brain Training 101, and at this recording, it's $49. It's very affordable. I teach you how to use that headband so that you can train your brain out of the ADHD pattern into the optimal pattern by yourself at home. And it's very efficient. It's quite affordable, and it'll totally help you. So if you're still watching porn, you need to get into the 90-day program. I also teach you how to use that technology there. But if you've been able to stay out of the screen and you think you have that buttoned up, Brain Training 101 might be a good start for you. And I'll make sure we put the link for that program below. But you can go over to drtrishleigh.com, scroll all the way to the bottom, and there's a workshops page there. But this is what I want you to know. This is the brain hack, is that you can take the control back. I know it seems like a cliche little saying that I made up a long time ago, but it's totally true. So if you're giving the control over to porn, it is controlling your brain. And at the same time, ADHD, this pattern that's in there, whether you were born with it or not, it might be controlling you to a certain degree. And you can take that control back when you use technology to heal your brain. Technology and neuroscience. You need the tech. You need the proper strategies also. That's what's in those programs. It will bring your brain back. It'll create more neuroplasticity and it'll allow your brain to heal. I've helped so many people who had oppressive ADHD that was just dragging them down, and now they don't have it anymore. And I owe it to the tech and the strategies that I was able to help these people do this for themselves. That's what I want you to know. Neuroplasticity can be your best friend or your worst enemy. Let's make it your best friend. Okay, go over to drtrishleigh.com, and until next time, control your brain or it'll control you.